Hi everyone, coming to you from rainy Victoria today. I'm sitting here with a cup of tea and I wanted to come on and chat a little bit about the hormonal causes of anxiety that I see in my practice. So as a naturopathic doctor, I advocate for investigating any contributing causes of anxiety. So obviously there's many causes, but today I'm just focused on talking about some of the potential hormonal causes. So why we see this is there is an interplay between our hormones and then our sex hormones specifically, and then our neurotransmitters in our brain. And then this can contribute to symptoms of anxiety. The 4 hormonal causes of anxiety that I'm going to speak about today are low estrogen, low progesterone, thyroid dysfunction, so both hypo and hyperthyroidism, and then insulin resistance. So whenever there's a hormonal transition, so when we're transitioning into menopause, perimenopause time, and then also during PMS, symptoms like hot flashes, insomnia, and then mood symptoms like anxiety and depression can happen. And so some of those symptoms are possibly due to the hormonal changes that happen. And then other things that can happen are mood changes and memory concerns. So those are not often spoken about, but I do ask about them because our ability to concentrate can be impacted during those hormonal transition times. And so these can all be due to symptoms of low estrogen and low progesterone. And so obviously there's lots of different ways to come at treating those symptoms. I always advocate for lifestyle changes first. So things like improving your sleep hygiene, cleaning up the diet, avoiding caffeine and alcohol, which can worsen all of those symptoms. And then obviously trying to minimize sugar, and something called cognitive behavioral therapy can be effective. And then obviously increasing movement. But at times when we've tried the lifestyle recommendations and we're still not seeing the improvement in symptoms, then we can look at doing a trial of bioidentical estrogen or progesterone. And then in addition to the changes that can happen during perimenopause and menopause, some of these symptoms can also happen during PMS. Hence why I ask all my female patients if they're experiencing night sweats regardless of their age, because some people will get them right before they're going to get their period. They'll experience some night sweats. So in these cases, I often will do hormonal testing to dig deeper and see if there's anything else going on. So that's estrogen and progesterone. And now I'm going to speak about insulin resistance. So the test that I do on pretty much all women in my practice is a fasting insulin and a fasting glucose. And so with that, we get a better sense of how you're handling the meals that you're eating throughout the day. And are you experiencing this blood sugar roller coaster? Like you eat breakfast, blood sugar spikes, you tank, and then you're tired, you feel lousy, and then you eat again, you get another spike, and it just kind of continues on. During those ups and downs, people can experience changes in mood, feelings of more anxiety. I'm sure, if you eat like a really chocolatey, sugary chocolate bar, you're going to feel anxious and wired sometimes. And so that just contributes to this emotional roller coaster that can happen. And obviously there's quite a lot of things that can be done to support that. But the first thing that I do is just get an assessment and a baseline of where someone is at. And then the final hormonal cause of anxiety that I see is both high and low thyroid function, so hyper or hypo symptoms can contribute and mimic anxiety, which is why I'm always advocating for a full thyroid assessment, especially if there's other symptoms, not just anxiety, but like fatigue, constipation, feeling cold, and in general just lethargic. It's a good idea to get a full thyroid evaluation done. All right, so in conclusion, the 4 hormonal causes of anxiety that I spoke about today: low progesterone, low estrogen, insulin resistance, so assessing a fasting insulin and a fasting glucose, and then doing a full thyroid assessment. I hope you found that helpful, and let me know in the comments if you have any questions, and I hope you enjoy your weekend. Bye.